Good afternoon. I call Human Services Finance Committee to order. Members, please take your seats. We have a quorum present. I'd like to begin with the approval of the minutes for February 29, 2024. Chair Fisher, did you want to move the approval for the minutes?
Yes, Chair Nor, I'd like to move approval of the February 29, 2024 minutes.
Chair Fisher moves the approval for minutes for February 29, 2024. Any discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed? The minutes for February 29, 2024 are now approved. Members, we do have a packed agenda today, but we'll begin with the presentation on background studies as promised from last session. So we have the Department of Human Services, Deputy Inspector General for Background Studies, and Director for Legislative Director. So we welcome
Mr. Chair.
Lead New Brinley.
Thank you, Mr. Chair. And I'm wondering, perhaps Mr. Herron will know or can answer. I'm wondering if we can get this presentation electronically?
Yeah. It should be on the...
It's not on the web page.
Members, you have it in your packet, and we'll make sure that it's posted there so you can have it.
I can go.
Oh, maybe it is here. I apologize.
It's not. I can go.
Yeah, if that could just be emailed out quick, that would be awesome. Thank you. It's not on the web.
Welcome. I don't know who's going to be starting. Welcome, Deputy Inspector General Davis. Please introduce yourself for the record and proceed with your presentation.
Good afternoon, Mr. Chair and members of the committee. My name is Dawn Davis. I am the Deputy Inspector General for the Background Studies Division with DHS in the Office of Inspector General. So thank you for inviting me here today.
Please proceed.
All right, thank you. All right, so today, this afternoon, thank you again for your invitation and the opportunity to provide a presentation with regard to the Background Studies Division and DHS's statewide background study system. This afternoon, I hope to be able to convey to you some of our process overview for the DHS background studies as well as due process, and then some information and references to the eligibility task force. So I would like to start off by being able to share that we believe we do have some similar values that we share with this committee and members of the legislature, in that DHS's background study system helps to protect people served by programs for which studies are required and conducted, while ensuring that qualified individuals can secure employment and provide services needed by their communities. As you may have heard last Thursday, some of this information is similar to what was presented last week. DHS does conduct background studies for over 65 provider types, with many having unique requirements. We believe that DHS's background studies are vital processes that are pre-screened, intended to safeguard children, vulnerable adults, as well as individuals receiving health care and human services, and then healthcare and human services providers' workforce. DHS's background studies also determines whether a person has committed an act that would disqualify them from being employed or providing services that require the background study. DHS's background study processes is more than just a background check. We perform a more thorough review of information from multiple sources. For our background studies system, 85% of background studies can clear within the first 24 to 48 hours. And that really sort of presents itself as a person not having any information on their record that can be cleared within 24 to 48 hours. For other applications, DHS staff are then required to seek out additional records from other agencies. Those other agencies may be in-state, records from law enforcement or courts, other states, particularly if the study subject has lived outside of Minnesota. In some cases, we have some federal programs that do require checks for every state that the individual has lived in for the past 5 years. And when we are sending record requests out to other states, DHS, unfortunately, we don't have the influence or control over records that are requested from other states. And so we are typically at the behest of the other state in terms of returning that information to us. DHS's background studies, we conduct many studies for a number of different state agencies and counties, tribes. I provide a short list here of some of the different state agencies that we conduct background studies for. Our Human Services Background Studies is governed by the authority of Minnesota Statutes Chapter 245C. Of course, we also must align to a number of other federal authorities as well. And Chapter 245C is reviewed and approved by the BCA and FBI to ensure compliance, and that enables DHS to receive that criminal history records information from the FBI. Certain federally funded healthcare and human services programs require fingerprint-based background checks. DHS's statewide background study system also must align to federal laws to request and receive national criminal history records. The BCA and the FBI, as mentioned, authorizes DHS's ability to receive that national criminal history records information, and we use several different federal authorities in order to do that. And so I list them here: National Child Protection Act, Volunteers with Children's Act, and the citation, as well as the Adam Walsh, which is one that's more familiar to a number of people, and Child Care Development Block Grant Act, as well as Families First Prevention Services Act. Those are just a few of the federal authorities that we have to have in order to obtain that criminal history information. I believe you all seen this slide last week as well. The only addition to this, this particular slide is regard to the total number of distinct applications. I want to also clarify that these are not duplicate studies. These are distinct, meaning one person, one study. If the individual does apply for another job at another company, that company also maintains a roster in that study too, and they would then submit a study at that new company that they are applying for. The number of distinct applications, you'll notice, has increased over the number of years, the last 5 years. Last year being our highest in 2023 at 507,000 applications that we've received through our Net Study 2 system. And I can share with you the dip in 2020 obviously is from the pandemic, where we had stay-at-home orders and peacetime emergency as well as the COVID-19, and made the transition to temporarily modify our background study processes as you know, the state of Minnesota was moving into that shutdown mode. Also, you all will be able to find on our public-facing website a process overview. We do present this information just in a general sense to help demystify background studies and to create more transparency for individuals as well as providers, trade associations, to have a sense of what the background studies process is at a high level. And so this overview process starts with the entity submitting the background study into Net Study 2, and then the study subject completes forms online that are consent and disclosure focused, as well as the study subject then would move forward to complete the fingerprinting requirement. And the individual has 14 days from the time that the provider submits the application into Net Study 2 to complete that fingerprinting portion. If no records are found and no additional checks are needed, the study subject, as mentioned earlier, could clear within 24 to 48 hours. in our system. However, on the right side, if records are found for the individual, then additional checks are required, and that may be checks that are in-state or out-of-state, where we're requesting records from other sources to make a determination of eligibility. And then finally, that big green box at the bottom is really just to kind of share that once in the Net Study 2 system, we continue to work on those background studies for those individuals. We also receive information through referral sources as well as RAPBAC, which is the Minnesota Court Information System RAPBAC service that provides ongoing streaming into our Net Study 2 system with information. And then, as I mentioned about the fingerprinting process, in 2021, DHS entered into a contract with IDEMIA, Identity and Security USA, LLC, otherwise known as IDEMIA. And IDEMIA is an international biometrics company that focuses on its effort working with government. They were selected through a competitive bid process to provide statewide services. The fingerprinting and photo service fees are $10.50, and those typically are either paid by the provider or the provider passes those fees along to the individual as they go to that location to get their fingerprint and photo taken. DHS has a 5-year agreement in place with IDEMIA, and that was executed in March of 2021. And the actual contract is a performance-based contract. We have many different performance measures and metrics that are built into the contract, and I'll share some of those in the next slide. Our contract does require annual review and renewal with IDEMIA if they are not meeting performance measures. So we do have that built into the contract where we're able to come back to the table if they're not performing. Also, IDEMIA contracts and does its own prospecting for partner sites. So DHS is not responsible for that portion. IDEMIA does have its own, as a channeler for the FBI, they have requirements. So when they're looking or prospecting for different partner sites, they are actually entering their own contracts with those partner sites to establish a site as a new partner. Sites, though, must be located within 35 miles of a study subject's home or place of employment. And also with IDEMIA, we are receiving full automated services. So they have pre-enrollment and appointment scheduling processes that are managed by IDEMIA's universal enrollment process. I will also sort of be able to add for you all that IDEMIA, as part of our contract, they are nationwide. And so for those providers who do a lot of recruitment that is outstate, IDEMIA services would allow for individuals to go to a site in another state, an Identigo site, to actually do fingerprinting that would, because it's on their universal platform, we would receive that information here in Minnesota. And this slide just shares some of those performance measures that I spoke about that are in our contract with IDEMIA. And so as we look through those, sufficient sites is one of the biggest ones that we're looking for with IDEMIA because they are covering the entire state of Minnesota. Their ability to turn around a site when a site closes is another major factor as far as performance is concerned. And then sites that are located within 35 miles, as mentioned just previously, the site hours of operation, including weekend and evening hours, fingerprint transmission failure rates, fingerprint rejection rates with the FBI, ability to provide mobile and gap coverage sites when closures do occur, and then percent of daily maximum site capacity. And I will share that our staff are meeting continuously in high frequency with IDEMIA since the onset of the contract. So we have a regular weekly meeting where we're discussing sort of a business and then a secondary meeting that is technical in nature around systems. So we are continuing to meet and have done so with IDEMIA since the onset of the contract. This slide just gives a little bit of a look for the IDEMIA's Identigo. That's their branded or marketing name of their fingerprinting sites. And this is their a link to or a screenshot of their website that any one of us could access. However, this is not their universal enrollment platform. That platform is received by an individual study subject through email. But this would at least allow for anybody to go to their, the IDEMIA site, the Identigo website, and identify locations based on zip code to find the nearest site. Now, switching gears to a part of the background studies process that is downstream is our due process rights for individuals. So in our DHS Office of Inspector General, our legal unit actually conducts and completes the reconsiderations that are received for individuals based on their disqualification determination. The Minnesota Department of Services, facilities and providers programs that are licensed, unlicensed, certified, and regulated by DHS, as well as we conduct the Minnesota Department of Transportation, transportation program providers certified and regulated by MnDOT. Those reconsideration and appeals are handled by our Office of Inspector General. For the Department of Health have staff that complete their own reconsideration processes on their licensed programs that are regulated by MDH. And then similarly, the Minnesota Department of Corrections also completes their own reconsideration and appeals processes for programs that they have background studies that come through DHS for. And with our due process rights, it's important to share that all background study subjects have the right to appeal their disqualification determination. And then appeals can occur when information used to determine disqualification is incorrect and or does not pose a risk of harm to people receiving services. So anyone has the ability to make the request for reconsideration of their determination. If the disqualification is set aside, then the individual is allowed to continue to work. And then finally, the last couple of slides just will reference a few items related to the Background Studies Eligibility Task Force that was established in 2021 to take a look at eligibility and disqualification with regard to background studies through DHS, not limited to sections 245C14 and 245C15. And so some of the, what the task force was able to move through after receiving a number of data sets from our background studies office was to consider the reform of 245C, the use of juvenile evidence in disqualification determinations, and then the simplified structures of look-back periods, as well as removing the disqualifying crimes that did not indicate an unacceptable risk of harm to health and safety of vulnerable populations that are served, and then standardization when disqualification look-back periods begin. And then this slide is also just a continuation of the recommendations, the top 7. Remove Chapter 245C's BARDA reconsideration request for, from permanently disqualified individuals, removal of the use of preponderance of the evidence standard to make disqualification determinations, and then undertaking additional reforms to increase the efficiency and user-friendliness of the reconsideration process. And in 2023, we had some legislation related to task force recommendations that did pass. The two that were enacted were the new standardized timeline for requesting reconsideration That went into effect July 1st of 2024, or will go into effect July 1st, 2024. And then new disqualifications for certain drug-related offenses, and that is effective August 1, 2024. And then we do have a couple of outstanding task force recommendations that DHS does believe would be good policy, and wanted to make sure we use the opportunity to share those with you all. A couple of the items are to remove the bar to set aside for any permanent disqualification that does not require federal compliance. Review current disqualification structure to consider if changes should be made to the look-back period or the number of disqualification tiers. And then also the final one is the 2023 legislature funded the planning portion for the automation of the request for reconsideration process. And one of the notions here is for the legislature to consider funding the implementation portion of the automation for the request for reconsideration process. And then that is all I believe I have for you today.
Thank you so much, Deputy Inspector General Davis. I know we have a lot of questions. I just wanted to start with, do we have recommended legislation for the outstanding pieces for the background studies? Director Buddy.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. I do not believe there's active legislation this session. There was a large bill that was worked on last session that I believe is still active, and we'd also, of course, be happy to provide technical assistance to any legislators interested in these topics. But I do know that Representative Edelson had a package of reforms last year, some of which made it across the finish line, as Director Davis indicated.
Just wanted to put on the record, we need a technical assistance on the remaining aspects of the background studies. And I think if we don't take care of those issues, we will be kicking the can down the road. So I'm hoping we can get something done this session. I want to begin with Representative Kwong.
Thank you, Mr. Chair. And I noticed you fingerprints and photo. Are you utilizing facial recognition when you do checks with other states?
Deputy Inspector General.
Mr. Chair, members of the committee, for background studies, it is a fingerprint and photo process, and so photos are utilized at the fingerprint vendor.
Representative Kwong, follow-up?
Yes, I was querying about facial recognition. I'll give an example. There was someone that was in Minnesota, ended up going to, I believe it was Arizona, had multiple IDs, and they caught him because of facial recognition, and that person actually, I believe, was charged. I didn't know what the results were for inappropriate activity with minors. So that's why I was seeing if we are also, as a state, utilizing that to verify that we don't have multiple people with that, and clarification of, are there any different procedures initiated because of real and non-real IDs?
I think those are complex questions which are not related to the background study because
No, actually, Mr. Chair, it is, because when you get a real ID, nationally defined, there's additional information that you provide to receive that. If you have just a regular driver's license, then you don't have that additional information, and there may be a need for additional information for clarification. So that's why I thought I could get clarity as to if they provide you a standard or if they provide you a real.
Deputy Inspector General, I know this is about fingerprints and that they're unique to the individual.
Yes, Mr. Chair and members of the committee, great questions. We have not had any interaction with the BCA or the FBI that has brought forward information about the use of Real ID in our processes. We do know that IDEMIA, as an FBI channeler itself, has a list of what would be considered identity verification in their platform. So as an individual is scheduling their appointment, they would also be selecting from a drop-down list of what they would be bringing to that location to verify or validate who they are. I'm not certain that Real ID has been placed in there, but that is a very good question, and we can follow that up.
Mr. Chair,
Representative Quam.
part of this is flowing out of the one that had the flow chart of process overview, and when it goes from the top level down to the next, there are two choices. There's not a lot of delineation, but one is no records found, additional checks. The other one is if records are found, and I wanted a clarification to that detail because there are variations across different states, and so I want to understand how we are compatible with the measures taken in other states. Thank you, Mr. Chair.
I thank you, Representative Quam. I have Representative Hicks.
Thank you so much for coming to talk to us about background studies today. So the organization that we have the contract with, where are they based out of?
They are based out of Virginia, is the United States home office for IDEMIA.
And
Representative
IDEMIA,
Hicks.
oh, I'm sorry,
Go
Chair. IDEMIA is a corporation that's controlled by an organization based out of,
Deputy Inspector General.
Mr. Chair, my apologies, and members of the committee. The IDEMIA is an international outfit, if you will. We are familiar that they are an international biometrics company. They have offices, I believe, in France as well as here in the United States. Our work is directly with the LLC portion, the identity and security that is here in the United States.
Representative Hicks.
thank you so much.
Mm-hmm.
And our contract with them, and I'm sorry, I was late for your presentation, so I do apologize. Our contract with them goes until 2026, is that correct?
Deputy Inspector General.
Mr. Chair, members of the committee, yes, it is through 2026. And then we are obligated by state law to do a new RFP process.
Representative Hicks.
Thank you, Chair. So in my community, this has been a very frustrating process. Rochester is the second largest metropolitan in the state of Minnesota. Our location has closed unexpectedly 2 or 3 times just this year, not counting the hiccups we had in 2023, the problems we've had in 2022. And it's without notice. I mean, Mr. Burdick's team does a great job of letting us know as legislators as soon as he is aware. But the most recent unexpected closure, I actually had 3 or 4 text messages from providers in my community prior to Mr. Burdick's team even being, I mean, literally, like their text came in and 20 minutes later, the email from Mr. Burdick's team came in. So when you talk about the monitoring and the processes and the things that are happening within that, as someone has the largest private employer in the state of Minnesota in her community and centers around healthcare as our financial driver, and our one location randomly just isn't open, I'm frustrated with this process specifically, and I'm frustrated to hear that we have 3 more years before we can look to do anything different. So I look to you to say, what do you say to my community in these situations? What is the solution for my community?
Deputy Inspector General.
Mr. Chair, members of the community, that is a great question, and it is frustrating to having worked with IDEMIA in a number of sites that open and close, and sometimes unexpectedly. And we understand that we have to have that mechanism in place in order for providers and individual study subjects to meet that requirement by law of getting the background check, the background study and fingerprinting. In terms of what would I offer is that as part of our upcoming RFP process, we would like to be engaged with a number of providers and trade associations to hear directly from you, to continue to hear from you about what we could do in terms of the next RFP process. What are some of the important things to you? We do know that for fingerprinting company or biometrics companies that can handle the entirety of the state of Minnesota, there are only 3. There are only 3 right now. And Gemalto Talis was one that we had a 5-year agreement in place with, IDEMIA being the second, and the third, I won't name them, but what I would say is that during the last RFP process, they had shared that they could not take on the full of the state. And so we do definitely need that statewide service, or if there is interest from the legislature and DHS, for us to look into becoming our own fingerprint vendor or channeler, it would be one opportunity. I believe there would need to be a feasibility study into that, though.
Putting that a pin on it, so I think we'll have more conversation. Let me give lead New Brinley.
Thank you, Mr. Chair, and thank you, Inspector General, for the presentation. This was actually quite helpful. So I'm looking at, I guess the slides are not numbered, the total of all distinct applications by year. From 21 to 22, there's an obvious jump, right? There was a backlog from the pandemic, so I assume that that's a lot of that, although maybe some of that was absorbed from 20 to 21. I'm wondering, though, the jump from 21 to 22 was clearly sustained in 2023. Can you tell us about why there are so many additional background studies? Is that something we've done as a legislature? Have we required more? What's the jump there?
Deputy Inspector General.
Mr. Chair, members of the committee, great question. Yes, the jump in 2021 to 2022 actually is attributed to a number of different factors. One is new provider types. So assisted living was one of the newer provider types that came on in 2021 that we took on. And then they doubled in 2022. So 34,000 was the number that was submitted in 2021, and 64,000 was submitted by those providers in 2022. In addition, I would share that as we returned from the emergency studies to the full compliance coming out of the pandemic, you had a number of providers who simultaneously had individuals who were employed that were still on the emergency study that were converting back to the full compliance study. So you saw numbers moving and shifting in that regard too, and increasing. As well, just a quick reminder that the emergency studies ended by legislature in 2022, December 31st, 2022. So we still had some overlap there.
Lead New Brinley.
Thank you, Mr. Chair, and thank you. That's very helpful. And I didn't realize it was the very end of 2022, so that would obviously keep those elevated in 2023. So we heard from MDH last week, I think it was, and one of the questions I think many of us on the committee had is, from a process perspective, you know, there might be an individual who is applying for several different jobs, and there may be different providers requesting a background check. What is the process to find duplication in the system? Do you know, does that exist, or does every hit initiate a new background study that must be done, or is there a process to streamline that a little bit?
Deputy Inspector General.
Mr. Chair, members of the committee, that is not an easy question to answer. There is so much complexity in the system, but let me try my best to answer that for you. When an individual may be applying for a job at X company, they also are applying for another job at a totally different company, maybe 2 different distinct types of jobs that they are applying for that have different requirements based on that provider type. So could be working at a hospital over here, but then also applied for a childcare position. Very different provider types, different federal authorities, different levels of requirements within the study itself. Each provider has a roster that is maintained in Net Study 2 by our background studies team in Net Study 2. And so a roster constitutes individuals that have applied for that job at X company that is submitted, and that's how we're maintaining, that's how regulation is maintained. So when licensors or the health regulation department goes and visits that site and asks for detailed information about who's employed, did they go through their background check, that's what they're looking for, is did they complete that study? They're looking at that employer's roster. Now, just a small caveat is that when we are requesting criminal history information from the FBI, you can only use that information for one purpose. You can't sort of take that same background study criminal history record information and then take it and carry it over here and have it apply to a different job at the child care center. So it is based on reason codes or federal authority is the other terminology.
Lead New Burnley?
Thank you, Mr.
Follow
Chair.
up last.
And that was very helpful. I appreciate that. And I mean, it sounds like those are likely privacy issues, that you can't take that background and apply it elsewhere. So that would be interesting to dig into, but, you know, is that a federal issue that we're not allowed to do that? Okay. So my last question is, I will just ask, from the Background Studies Task Force, you talked about a number of recommendations, and I'm just wondering, right now, that first bullet says reform Chapter 245C's use of juvenile evidence in disqualifications. What is the current statute? Does it allow that evidence to be used? Does it not allow that evidence to be used?
Deputy Inspector General?
Mr. Chair, members of the committee, I don't have that right in mind. I've got a lot of other stuff in mind that I can rattle off, but this one I cannot. I'd have to provide some information back on that question.
I have Representative Zelesnik.
Thank you, Chair, and thank you, Deputy, for being here today. My questions are, if you could define from the graph what your words were, the emergency studies were used. I can see the graph, the numbers are lower. During the emergency studies, it ended on the 22nd, or December 31st. What were the differences between the emergency studies period versus the full compliance studies?
Deputy Inspector General?
Mr. Chair, members of the committee, can you clarify, are you looking at a particular year, or are you just saying in general? Are you asking?
Representative Zelesnik.
Thank you, Chair, and thank you, Deputy. My question is, you referenced the emergency studies were used, that in, I'm guessing, 2021, when we were in the pandemic. Mm-hmm. What did they look like? What did we do for the emergency studies regarding background studies? What processes were done for an employer to hire somebody at a child care center, nursing home, assisted living, et cetera?
Deputy Inspector General?
Mr. Chair, members of the committee, there were modifications that were put in place, also granted by the federal government. So it makes me think about, as you just mentioned, child care. We had to receive waivers at the federal level to allow us to modify or bifurcate sort of our existing full compliance process in order to do Minnesota-only name and date of birth. So those were primarily the studies as emergency background studies that we had done. At that time, again, most individuals around the country were starting to work from home, working remotely, and so we did not request it. In our modification, we were not requesting records from other states. So it was truly just Minnesota-only name and date of birth for the majority of the study types that we have. There were, in some cases, as time went on into the pandemic, I would say probably the end of 2020, the first part of 2021, where we knew we had a number of courts that were concerned that they were seeing a backlog of foster children, foster parents, things like that. And so they had asked us to come back online with full compliance in those cases, and we did. In certain instances, we were able to kind of retool to come back through modification again within our own DHS processes to reinstate certain aspects for certain provider types. And that also occurred at various points as the federal government, for certain programs, started to ask us to return. Their waivers, the waivers were being finalized at certain points throughout the pandemic, so we had the need to return to full compliance as those federal waivers were ending.
Final follow-up, Representative Zeleznik, if you have any.
Yes, Chair. So is it fair to say that during the emergency studies, there were background studies for assisted living, for example, and nursing homes, for example, but we didn't do the fingerprinting?
Deputy Inspector General.
Mr. Chair, members of the committee, I would want to reserve my answer for that. Without seeing data, it'd be difficult for me to try to share that with you. I know that the assisted living was brought on during the pandemic, but we did phases. We reintroduced providers back at certain points in 2021, starting in September, with the child care group, and each month thereafter started to do a phase-in of different provider types. I believe MDH at large was the largest provider type that came back in at the tail end. But not having that information right here, I'd be mistaken to say something that may be off a little bit.
We can follow up with some of those issues as we go along. So did you have any quick, otherwise I have Chair
I have
Fisher.
several questions, but Chair Nora can follow up later. I guess on the background studies, the state has the jurisdiction and made decisions to do an elevated study in the assisted living arena and made that legislation at a state level for jurisdiction. And so when I'm just looking at this data, the regulation rules changed, obviously, in an emergency waiver, and now we are back to the full compliance issues, and we really don't have any data of what, I haven't seen any data of what the implications for patient care were versus the emergency orders or the full orders. And so when I look at the process, it's interesting. I'd love to see data on that. If you have data of what the implications were when we were in emergency orders versus the process we're doing now. To the point that Representative Hicks is making, and I'm hearing across the state, we have a workforce shortage and we have people waiting. We are in a pandemic right now. I just met with nurses from M&A. They're all saying staffing is worse now than it was in the pandemic. So we have to find ways to make sure people are being processed and with assuring quality outcomes. And so I think the goal is that. So thank you.
Thank you, Chair Fisher.
Thank you, Chair Nora, and thank you to Deputy Inspector General for being here today with the presentation. Most of my questions got answered through questions that Lead New Brindley had, but the question I have that we did not get to is, we see what the jumps were and what the volumes were for the years up through 2023. What are the thoughts going to happen in, say, 2024, 2025? Is that supposed to drop down? Is it supposed to stay at those levels? And I'm just thinking the volume also has an impact on how well people are processed through.
Deputy Inspector General.
Mr. Chair, members of the committee, Mr. Fisher, thank you. In terms of predictable analytics, I cannot necessarily say what next year or this year at the end of the calendar year will look like. There is no mechanism in place in the background studies system itself that prevents a employer or provider from submission. And so it is really based upon that provider's workforce needs in terms of their submission.
Chair Fisher.
Thank you, Deputy Inspector General. And the reason I'm asking, because I was concerned when you mentioned earlier, there's only a couple places in the country, two right now in the country, that were saying they're willing to do this. And wondering if where we are in the volume, is that going to limit us, or is that going to force us into a situation when we have to run it ourselves? And I know there was talk about maybe we need to do a feasibility study. Can you shed any light on that?
Deputy Inspector General.
Mr. Chair, members of the committee, Mr. Fisher, so it was in 2019, 2020 when we had the original RFP. And at that time, there were a number of entities that submitted their bid. However, many of them could not fulfill the entire state. They would only want a portion or a certain segment within Minnesota. That becomes such that it is, for many of the larger entities that are biometric agencies, they usually all want to be exclusive and not have, sort of a part of Minnesota or, this midsection of Minnesota or southern tier of Minnesota. They would want to have the entire state. It also creates another challenge in trying to introduce a secondary fingerprint vendor because of the technical nature of connecting not only our systems and retrofitting with whatever their process and technology is, as well as with the BCA, in order to funnel those fingerprints through and receive our results back through the BCA. So having multiple fingerprint vendors could be more complex, one. Two, confusing for individuals as to where do I go? Do I go with biometric company A, biometric company B? It could turn into a nightmare to just try to receive that information in. One of the notions here as we move through an RFP process, the DHS's background studies has just become a member of the Professional Background Screeners Association, which is an international association where they have many individuals in this sector. And one of the notions around that membership is to become more familiar with, are there other fingerprint vendors that can work in an entire state in such a way that is beneficial for us. I won't know that until I'm able to attend one of their conferences, and hopefully we'll do so later this year.
I think we have a lot of follow-up, and I'm hoping that we can also get the language for the feasibility study so we can get going. So, Director Buddy.
Thank you, Mr. Chair. Just wanted to note for the committee, if you haven't already received it, we also are following up in writing to the question that was received last week on nursing homes. The short answer is it is calculated into the nursing facility rate. It gets more complicated from there, so I'll let the written experts stand on that. So that should be in the committee's inbox if it hasn't already been received.
And just to follow up on that, I think we're also waiting for the traditional PCA program that we authorized last year in terms of getting it going. So thank you so much, Deputy Inspector General and Director Virnig, for the testimony. We will have more questions later on. We have got 3 bills. We will try to do as quick as possible. So the first bill is Representative Frederick, House File 3835. I'll move the bill for you, House File 3835, to be laid over. Please introduce your bill and begin your testimony.
Thank you, Mr. Chair and committee members. House File 3835 would be a bill that would allow for some unit-based services to be billed without being in direct contact or remote contact with the individual receiving those services. The language prescribes very specific situations that would be billable and also includes language required informed choice from the person receiving the service. So to paint the picture for the committee, I want you to imagine that there's a person who's receiving services. The person that's providing those services is in their home, and they are trying to schedule a doctor's appointment, and they have to leave a message for whatever reason. That person that's providing those services then leaves for the day, and the doctor's office ends up calling them back while they're at the grocery store or somewhere else, not in that direct contact. What this bill is aiming to do is saying that that person who's no longer providing those services, who is now in a different space, can answer that phone call, can make that doctor's appointment without being physically present, and still be paid for that time. Because right now they're faced with kind of one of two choices, which is either don't do it because they're not on the clock to do it, or two, make that appointment still without any sort of compensation. So this is a bill aimed to address that scenario.
Thank you so much, Representative Frederick. So you have your first testifier, Mr. Benz. Welcome to the committee. Please introduce yourself for the record and proceed.
Thank you, Chair Noor. Good afternoon, committee members. For the record, my name is Ken Bentz. I'm the Director of Research Analysis and Policy at ARM. As you know, we are a trade association of residential service providers providing services through the 4 disability waivers across the state. I'll be as brief as I can to describe the details of this bill. House File 3835. Representative Frederick did a nice job of introducing it. This applies specifically to the Individualized Home Supports, or IHS, suite of services in the disability waiver rate system. Today, a provider can only bill for time providing one of these services when they're in direct contact, either personally or remotely, with the person receiving services. But we know that allowing for time to be billed in these circumstances does not reflect the reality of how the services are provided. There are a few examples of activities and time spent after client visits that are currently not billable, such as coordinating care with the case manager and support team, assisting in health coordination and setting up medical appointments, assistance with housing, economic assistance, coordinating legal support, and arranging for access to resources to meet basic needs such as food shelves and phone and internet access. Providers report needing to sit on hold for very long periods of time, or there are instances of playing phone tag back and forth. And since the provider is usually in front of or with the person for very limited periods of time, often these phone calls take place after they've left and are no longer in direct contact, as Representative Frederick said. Also, when communicating through email, a lot of those happen after the fact. And so it's not feasible for the service provider to wait until they are next back with the person, which may be a week or more in the future. So House File 3835 would change what is considered billable time in these services, allowing for some indirect time to be billed only when specific conditions are met and only when the individual makes an informed choice to allow for this billing to occur. I want to acknowledge that there is a current rate, that in the current rate framework for these services, there is a component value called program plan support that accounts for some of the time a provider would spend providing indirect support. But this component value has not been adjusted since it was first introduced over 10 years ago, and it does not reflect the actual time spent or the true cost of providing these services. And so the changes we are proposing would account for that. And these changes are in step with other services on the DWRS. For example, the 3 employment support services include the program plan support component and also include the additional indirect time as we're proposing. And also housing stabilization services, while they're not framework services, they do allow up to 49% of the services to be provided indirectly. So with the unpredictable nature of people's lives these days, allowing for more indirect time to be billable is in everybody's best interest. I want to draw your attention to a letter from Pine River Group Homes, which is in your packet, which describes the situation very well. There's an additional testifier, and I'll be happy to stand for any questions.
Thank you so much, Mr. Benz. The next person is Larissa Beck. Welcome to the committee. Please introduce yourself for the record and proceed.
Hi, my name is Larissa Beck, and I am the Director of Community Living Services at Reach for Resources. I'm here to testify on House File 3835. Reach for Resources provides IHS, individualized home supports, with training to about 75 people within the Twin Cities metro area. It's a service that we can only bill for our direct time that we are working with the person that we're supporting, whether that be done in person or remotely. The goal of the service is really to be able to help people to achieve independence in different areas of their lives as they develop their goals and their outcomes. Last week, I got a phone call from one of my in-home staff after she had received a phone call from somebody that she supports, somebody that she works with, saying that she was suicidal. She was on the phone with her for 15 minutes, and that equates to $11.66 for that 15-minute phone call that she had as remote supports with IHS services. After that initial phone call, she stopped responding to anyone and everyone. We called and tried to be able to talk to her mom, and tried to be able to talk to her boyfriend, both whom are her emergency contacts. We called and talked to her case manager, her arms worker, her employment provider, her housing provider, that she does HSS, Housing Stabilization Services with. And there was a ton of coordination and a ton of communication that needs to be able to happen with the team. My staff then spent the next 2.5 hours on the phone with all of those other people of her team, the police, her daughter's school, Mark, the Minnesota Adult Abuse Reporting Center. And she was hospitalized and ended up thankfully being released later on that day. My in-home staff then needed to write up a report for the incident report that we're required to do. Report that out to the team, report to the team what was going on, what was happening, because she was acting as that main contact, that main person to go to for everything for her. She helped to be able to coordinate the necessary follow-up care for her daughter, who was going to pick her daughter up from school that day and get her over to the other grandma's house that she could go and be with and be safe. She continued to be able to coordinate those services and communicate what supports was needed for her. And this all takes time for us to do, but it's also required for us to do as a service provider to be able to make sure that everybody's informed. So then what ended up happening is the person she supports got mad at her for reporting this. And she stopped communicating with her because she needed to then go to the hospital and receive all of this extra follow-up stuff that she didn't really want to do, but obviously that's what we need to do in that instance, in that place. So she stopped communicating with our staff. And she certainly tried to be able to continue to connect with her by phone, by text messaging, but since we didn't hear anything back from her that day, all that we were able to bill is that one 15-minute phone call that we had for that $11.66. She had another 2 to 3 hours of time that she worked for her for that day on her behalf. So for a total of that 5 to 6 hours of work that she did, we're reimbursed $11.66. If we were providing employment services for her, we would have been able to bill for all of that time, all of that communication, the coordination of care, the follow-up, is what we're required to do. And fortunately, she has a really good established relationship with her staff. They've been working together for the past 5 years or so, and they normally spend 6 to 7 hours a week. This is her person that she is going to call to be able to talk about these things because of how close and how good of a relationship they have. And so while yes, the goal certainly is to be able to help people to become more independent and to operate those services with those people that we're working with, we want to be able to do all of those things with our people. Days like this happen, and for that 5 to 6 hours of work that we need to do, we're only getting reimbursed $11.66. Thank you for your consideration with House File 3835.
Thank you so much for your testimony. Do we have anyone in the public who wanted to testify on this bill? Seeing none, member discussions. Lead New Brinley.
Thank you, Mr. Chair, and thank you, Representative Frederick. It seems obvious that there are a lot of services being provided without compensation, which is obviously problematic. I'm wondering, though, I don't see in the bill, and maybe we need to consider a limitation on what it could be. I mean, I'm imagining a situation where literally, I mean, say somebody's receiving however many hours of support a week, 20 hours of support, I can imagine that another 20 hours would go into this kind of stuff easily, which may be the right thing to do, but I'm guessing will have a really hefty price tag for us. We don't have a fiscal note on this yet, is that correct? I assume one's been requested?
I'll ask the fiscal analyst.
Mr. Chair, Representative New Brindley, there is a fiscal note request which is currently suspended. I understand from the department they have some technical issues, which I think they will reach out to the author about.
New Brindley.
Thank you, Mr. Chair. I wonder if part of that is this, that it's difficult to gauge what that might look like. Again, seems very reasonable that providers will be reimbursed for these expenses, but I wonder if we need to have some kind of guardrails around that, even just to be able to create a fiscal note, I wonder. So, thank you, Mr. Chair.
Thank you. Larissa Beck, if you want to come and respond quickly.
Yes, hi again, committee and chair. So every person has an authorization for their services that they are already receiving. So this person specifically, she has 10 hours a week that's authorized for us to be able to work with her. We would still need to fit within the services that we're already authorized to be able to provide. So, this situation with her, things happen with her specifically. She's somebody who has some extra involved. But this isn't something that we, count on happening on a regular basis, obviously.
Mr. Chair, follow up.
Quick one.
Thank you, Mr. Chair. I appreciate that. And I just want to make sure I understand that that is laid out in the language. Do you know within the language of the bill that is clearly defined, that this all falls within the allowable expenses already, or those allowable hours already?
Representative Frederick.
Mr. Chair, I would say that the intention behind the bill is not to expand any of the hours that a person would already be allocated.
Okay, so,
New Brindley.
Mr. Chair, then we might want to just make that very clear in the language to make sure, because if these hours are already allocated for, then it makes it much easier. I don't know why we wouldn't just do it, as long as it's not an expansion. Thank you, Mr. Chair.
Thank you so much. We have the bill in our possession, so we will keep on working on it as we go forward. Representative Frederick, if you wanted to provide any closing remarks.
Thank you, committee and Mr. Chair. That I would say that while the bill is not looking to expand services either, one of the things that is very intentional about this too is to not take away that consent that is still very much about the person making their own decisions and then just having that care provider to be able to support them in that. And so I just want to make sure that that's said again too. So I just want to thank the committee for their time.
Thank you so much. House File 3835 is laid over. The next bill that we have is House File 3907. Representative Virnig. Representative Virnig moves the House File 3907 to be laid over. So please introduce your bill and proceed.
Yes, thank you, Mr. Chair and committee members. I move an author's amendment based on TA from the advocates who worked with the department to get the bill in the shape that I'd like.
We have A1 amendment. So this is to put the bill in the shape the author wants. Any discussion on A1 amendment? New Brindley.
Can Representative Virnig just tell us briefly what the A1 does?
Representative Virnig, do you want the nonpartisan staff just in case?
Sure.
All right. Ms. Pugnelli, if you wanted to provide just high level.
Mr. Chair, members, the author's amendment makes some adjustments to the list of uses of allowable grant money.
New Brindley, any discussion?
Thank you, Mr. Chair.
All right, all those in favor of A1 amendment, please say aye.
Aye.
Opposed? Abstention? The amendment is now adopted. So with that, to your bill as amended.
Yes, thank you, Mr. Chair and committee again. In front of you today is House File 3907, a bill brought forward by ARM. It must be ARM Day again here. The Trade Association of Residential Service Providers supporting people with disabilities across the state. This bill would appropriate $2.5 million in 2025 and $2.5 in fiscal year 2026 for grants to providers to build capacity in services and support of individuals in their goals to transition from provider-controlled congregate settings to living in their own homes. As providers continue to support people in their housing goals, these grant dollars would help fill in gaps when waiting for services to be authorized, provide resources for providers to be innovative and build out services they provide, as well as incentivize providers to support people in non-congregate settings. Today, I have a couple of testifiers, so.
Mr. Tivet, welcome to the committee. Please introduce yourself for the record and proceed.
Good afternoon, Mr. Chair and committee members. For the record, my name is Johnny Tivet. I'm the Policy and Engagement Manager for ARM. ARM is a trade association of residential service providers providing services through the 4 disability waivers. The bill in front of you today is seeking a one-time grant to incentivize providers to support individuals in moving out of group living settings and into one's own individual home. The grant would be in the amount of $2.5 million in fiscal year 2025 and $2.5 million in fiscal year 2026, appropriated from the general fund to the Commissioner of Human Services. The grant would be allowable on expenses which enhance resources and staffing support for people moving into an independent living situation to better understand their housing options, to provide resources for housing expenses related to moving, and the implementation and testing of innovative approaches to better support people with disabilities and their families in living in their own independent space. As ARM works with over 160 member organizations supporting individuals in a variety of living settings, we find more and more that independent living spaces are needed for folks moving out of congregate living settings. The issue they run into often come in the form of logistics and an understanding of options. How will someone move into their own home and tackle accessibility and service options? How can we find the best housing option which makes sense for both the person seeking the housing and their family? And how can we further develop a standard in making this transition smoother across the states to support people with disabilities in becoming more independent? We believe that this one-time grant could set the standard and provide a playbook for individuals moving forward in this critical point of transition. While this particular grant would end by 2027, our hope is that we can take learnings and services developed with these dollars and replicate them across the state. Our members are partners in supporting people to live where they choose. We're excited about the opportunity these grant dollars could open up and are looking forward to a continued partnership with the state in expanding and innovating services that are supporting people with disabilities. With that, I'm happy to answer any questions that the committee may have.
Thank you so much for your testimony. The next person I have is Stacy Rowe. Welcome to the committee, and please introduce yourself for the record and proceed.
Good afternoon, Mr. Chair and committee members. For the record, my name is Stacy Rowe. I am the Board of Directors President at ARM, and I work for a home and community-based services provider, Meansville Services, where we offer a variety of services and supports to people responding to their hopes and dreams. And I'm here today in support of House File 3907. Back in 2020, legislation was passed and Minnesota adopted an independent living first policy that states each adult Minnesotan with a disability be offered the opportunity to live as independently as possible before being offered supports and services in a provider-controlled setting. As with any systemic change in how and where people are supported, many providers will need to innovate and resource differently than they are now in order to honor the shift in policy. This will take time and money that many providers cannot currently afford, or even if they can, still need that little push to go in that direction. As we do the work to explore with people where and with whom they want to live, when they identify that they would like to move from congregate care to their own home, multiple actions must be taken. There are currently some services and supports in place to work with people during these times of discovery and transition, but as you can see by the pace of change, there is more resourcing needed within the provider network. Grants are an important targeted tool to help move us to truly being an independent living first state, and I appreciate your consideration of this bill.
Thank you so much, Ms. Rowe, for your testimony. Do we have anyone in the public who wants to testify on this bill? Seeing none, member discussions. Lead New Burnley.
Thank you, Mr. Chair. And thank you, Representative Virnig. Am I pronouncing your name correctly? I apologize. Thank you, Mr. Chair. So I am wondering about the language in the bill. So for example, on line 1.7, it uses the word incentivize providers to support individuals moving out of congregate living settings and into an individual's own home. And then it's allowing us to provide these grants for enhancing staffing to support people in just understanding housing options. I mean, as I look through these things, it feels like obviously in Minnesota we choose to support people as liberally as we can in helping people live the way that they choose to live. But as I read this a little bit as that we are like purposefully trying to move people towards individual settings instead of congregate living settings. Am I understanding that correctly?
Representative Virnig, or did you want to phone a friend?
I would like to phone a friend because that is not how I understand it, but I want to make sure that they explain it.
Ms. Rohr, welcome back, and please proceed with the response.
Chair and committee members. So the state adopted this independent living first policy as a state. And my understanding of the intention of what we're trying to do is if you consider the provider community and we do what we do. Like some of us do a variety of services. Some of us only have congregate care settings. And one of the biggest barriers to people who have, if we successfully supported a person over a period of time to develop the skills and abilities to live more independently, there are people who want to move out, but maybe the group and team of people surrounding them don't know what other options are available, don't understand the process and the steps that they would need to go through. And so if I'm a provider and that's the work I do, that I could apply for some of these grant dollars to then staff up, get some technical expertise and training in my organization so that when somebody is working with someone and they identify this, they can actually help them on that journey. Because we see that people are just like, well, I don't know what to do. So that would be a big reason.
Thank you, Mr. Chair, and thank you for that. That is interesting. It's something that we should think about, that this independent living policy first. It should be independent living policy first if that's what people want, right? But I think a lot of folks want to live in a congregate care facility. I would just ask that we look at I understand the idea of making sure that they have those resources. I look at the amendment and the language that was added, line 1.6, and I think, does that cover moving boxes and packing peanuts? It feels like this is maybe a little broader than I would like to see, and I get a little concerned when I see financial incentives for providers that have successfully moved an individual out of a congregate living into their own home. I don't want to incentivize providers to move folks who may not want to move. Now, don't get me wrong. I work with a lot of group home providers in my own district, and I know that that's not who they are, but we also don't want to incentivize bad actors. And we certainly don't want to coerce or push folks to adopt a living setting that is actually not appropriate for them or that they're not interested in. Thank you, Mr. Chair.
Thank you. Representative Virnig.
I'd like to comment. Yeah, I think the amendment language that came out of this discussion after the policy meeting where we wouldn't double dip on funds. So if there weren't funds already available by other means, they could be used through this grant funding. But we want to make it very clear that we're not double dipping as well. If I understand correctly, right? Yeah.
Yeah, then to clarify, I guess I would ask again, does that literally mean that we're going to be paying for moving boxes and packing peanuts? It seems like that's allowable under this language. There's nothing restricting it for sure.
Ms. Rohr.
committee members. So there are currently dollars available through programs for moving expenses that people can access. It's up to a certain dollar amount. This would be in the case of if someone didn't have access to that, or if there was certain things. Again, going back to when we look at what the barriers are to people who want to move out, it's often things like, well, you can't afford dishes, you can't afford this, you can't afford first and last month's rent. And so looking at how can we use grant dollars to get us past those barriers for the people who it is an appropriate move to their own home and who want to move to their own home.
All right, Representative Quam.
Thank you, Mr. Chair. And you mentioned there are existing programs. What sort of distribution across the state are these existing programs? Is there any idea of where the grants are predominantly going to be associated? I would hope if you have existing programs, you've analyzed there are holes, and we're going to try and utilize the grants to, cover those areas of the state that don't have existing capabilities. I know non-emergency medical transport entities that do that also do some of the bringing or taking people from a facility into a home setting. And so I'd really like to understand that type of analysis and be reassured that, we did this analysis and that's why we're sizing it the way it is, and we have mechanisms to direct it to where the greatest need would be.
Is that a question that we can follow up later so we can get the data?
Yeah.
I'm sorry, Chair. I figured they would, when they mentioned existing programs, they'd already have that data that they could have shared. The other question is, what checks, verifications to prevent fraud and repeat fraud do you have? Because it's well documented multiple times of fraud in these in programs and in the department. And in fact, the last audit where there was some fraud, there were entities that had already been flagged in previous programs from the department, repeat possible offenders, because it hasn't been determined positively that in this newest case there was fraud. So what checks and balances do you have for this program to reassure us that the money will be utilized to help people and not be susceptible to fraud?
Ms. Rowe?
Mr. Chair and committee members, so through the grant application process, I would expect that DHS would have a way to rule out not giving grant dollars to providers who are being fraudulent. And then they would have to say how they're going to use those dollars. It would have to be in alignment with the uses, and it would have to be approved by the department to use the dollars for that, and then they would have to report back. And so that would be the way that they would manage to that. And going to the kind of the question around the other services. So for example, there are housing services providers that help people find and secure housing. These grant dollars are for the congregate care settings that maybe don't have those services internally, to then be able to build up their knowledge of even pointing people towards the directions of accessing those services. There's just this gap in between where there are things available out there, but we need to get our community to a place where we have the awareness and the connections to be able to support people on that journey.
Representative Quam, we've got another bill, so I'll go to Representative Hicks.
Thank you so much, and thank you for this bill. You mentioned that folks have barriers to being moved out of congregate living settings, and I think it's important that we just sort of pause and look at the disability community for a minute and talk about the fact that for many, many, many years, really until the last 50, people with disabilities were assumed incompetent to live in the community, and they were placed in state institutions. And then when we shifted to a community-based model, the expectation was that if you had a disability, you would graduate from high school and leave your parents' house and go to a congregate living setting. And there were not conversations with teenagers with disabilities about independent living. There were not conversations about the what ifs and the dreams and the futures and what could be. There were only conversations about, here is the service that you qualify for and there's a bed attached to it. Let me show you who you're going to live with now. And the state's commitment to letting individuals with disabilities be people and community members first, and then people with disabilities who need support second, is a great civil rights movement. And it's unfortunate that none of the testifiers here are people with disabilities who have been seeking housing, but I will tell you from my conversations within my community, the barriers are not because they don't want to. And it's not because they don't have the desire or, in many cases, the skills. It is the types of things that you talked about. It's also the lack of housing affordability. When you live on Social Security and some working income that's pretty minimal, it is really difficult to find housing that you can afford. So even if we have the right services, being able to find housing, being able to get into that first apartment, being able to do those things is so important. And I think it's important that we continue to just remember that people with disabilities are a protected class in both federal, in federal law, and that we speak about my community frequently like they don't have a choice and like they should be taken care of instead of empowered to make their own choices. And so I love bills that give them the power to make their own choices. And so I just want to say thank you again for bringing this forth. I know I've heard it twice now. And I am really glad about the amendment because there are some wonderful federal funds that we can pull down on when people are looking at moving from congregate setting into community settings. And so making sure that we're using state dollars only to cover the things that aren't covered in some of those other programs is really important. So thank you for that amendment and thank you for this bill.
Thank you so much. So to your closing remarks, Representative Virnig.
In the interest of time, I'll just say thank you for your consideration of House File 3907 for these one-time funds to support providers and people moving into independent homes.
Representative Virnig renews her motion that House File 3907 to be laid over as amended. The bill is laid over. The last bill, but not the least, is House File 4219, Chair Pryor. Chair Pryor moves House File 4219 to be laid over. Please introduce your bill and proceed.
All right, thank you, Mr. Chair. Thank you for hearing this bill. The bill before you will help the smallest nursing home in the state, a 21-bed facility that recently moved to my district. It makes a one-time exception to the formula for determining a payment rate within the renovation and relocation fund that the department has in their base budget. Despite state and federal assistance to many affected parties around the state, we're still finding folks for whom the pandemic created untenable costs. And this bill seeks to offer assistance to my constituents at this nursing home without spending new money or reinventing the moratorium exception program. In 2023, based on the application submitted, if the department funded all the applications for the moratorium exception process for renovations and relocations, they would use $1.6 million of the $5 million allocated for the year. This leaves plenty of funding available to assist this small provider that was hurt by the pandemic-related delays and inflation while relocating their facility. And joining me today is Jeff Sprinkle, the administrator of Hope Springs, to share more about their journey and the bill before you today.
Welcome to the committee. Mr. Sprinkle, introduce yourself for the record and proceed.
Thank you, Chair Knorr and members of the committee. My name is Jeff Sprinkle, and I'm the administrator of Hope Springs at Minnetonka. Hope Springs, as was said, is a skilled nursing home. We are the smallest one in the state. We made application to the Nursing Facility Moratorium Exceptions Program to build a new facility in December of 2019, right before the pandemic, to replace a building that was over 110 years old, had just 4 toilets for 21 residents and staff, and relied on almost all double and triple rooms. We needed a new building. We needed one badly. We were serving an underserved population of residents, all with mental illness diagnosis, And prior to the pandemic, we were consistently at 98% occupancy despite having double and triple rooms. We applied to the Minnesota Department of Health's Nursing Facility Moratorium Exceptions Program. This is the only mechanism available to replace older nursing homes in the state of Minnesota. The program, as was mentioned, is funded with a permanent appropriation, so no additional general funds are needed for this request. As also was mentioned, there's currently $5 million in the fund, and the 2023 proposals, if all of them are adopted and accepted, would only use about $1.6 million of the fund. As a benchmark, just so you can understand, the original cost of approving our facility from the fund in 2020 was just $167,000. I am estimating that the cost of this request increase from the moratorium exceptions program would be very minimal. Between the pandemic, supply chain problems, inflation, zoning issues, our approved project did not go as smoothly as was planned. Hope Springs at Minnetonka was located in Deep Haven up until March of 2023 when we completed our new building. Twice we were rejected on different sites, including our former location in the city of Deep Haven. So we had to move to a new location in Minnetonka. This caused significant time delays and site cost expenses. In addition, the project encountered unexpected inflationary and supply chain issues, as you can imagine, from the pandemic and that time period. It created a perfect storm for significant cost increases to the building, none of which was anticipated when we began this project. The language in the moratorium exception bill identifies limits to the building process with a very specific formula. We are not asking for this formula to be changed or altered in any way. We're simply asking that our original estimated expense of the project be replaced by the actual completed appraisal costs of the building within the pre-existing limits of the program. By making this change, we will be able to continue operating and serving this niche community. Thank you for considering this bill. We have also received some technical assistance on this bill from DHS, and we look forward to incorporating that as the process continues. I'm available to answer any questions if there are any.
Thank you so much for your testimony. Do we have anyone in the public who wanted to testify on this bill? Seeing none, member discussions? Well, Chair Pryor, you've done well, so nobody has got any questions. Any closing remarks?
I want to thank the committee and the chair for hearing the bill. Had a chance to visit and want to support the people that live there, and this is their home, and this is an exception that they need to make sure that they can continue to live there.
Thank you, Chair Pryor. We'll continue to work with the DHS to figure out the process going forward. So Chair Pryor renews her motion that House File 4219 to be laid over. So the bill is laid over. Members, that was the last bill. We don't have any agenda items on our list. We are now adjourned.
Thank you.